Alhamdulillahi Rabbil Alameen wa salatu wa salamu ala rahmatan lil alameen. Assalamu alaikum. Today we're going to discuss about immunity. What is immunity? Immunity is a natural self-defense mechanism by which the body resists the invasion of microorganisms in tissues such as viruses, bacteria, or fungus. A healthy immune system ensures that the body does not suffer from prolonged illness. Medications may support the immune system but cannot replace it. Immunity can be classified into two types: innate immunity, which is present by birth, and adaptive immunity, which is developed within an individual with the passage of time. Before we dive into the complexity of immune function of the body, let's briefly review the production and classification of white blood cells, also known as leukocytes. Regardless of the type of immunity, hematopoietic stem cells inside the bone marrow should be producing normal number of white blood cells. The normal number of white blood cells is 4,000 to 11,000 per microliter. The production of white blood cells is known as leukopoiesis. White blood cells can broadly be classified into two types: myelocytes and lymphocytes. Myelocytes can be further subdivided into granulocytes and monocytes. Monocytes are the largest blood cell circulating in the blood. After 24 hours, they migrate into the tissue and form macrophages. Macrophages in the lungs are known as alveolar macrophages, in the liver, Kupffer cells, in the skin, histiocytes, in the nervous system, microglial cells. Granulocytes are further divided into basophils, neutrophils, and eosinophils. Neutrophils are the most abundant circulating white blood cells. Eosinophils are usually associated with allergies, while basophils are quite active against parasites and fungus. Neutrophils and macrophages are part of the innate immunity. Neutrophils are usually attracted towards the damaged tissue and stick with the blood vessel wall through integrins. You can remember integrins as the second alphabet in integrin is N, and the name neutrophils also starts with N. Integrins expressed by neutrophils can bind ICAM, intercellular adhesion molecule, expressed by endothelial cells, and they can roll. In this way, the neutrophils can make their way into the tissues by a process known as diapedesis. It's a process by which white blood cells, particularly neutrophils, extend itself using pseudopods through capillary wall into the tissues. After entering the tissues, the offending agent is phagocytosed and the dead material is removed. Tissue damage may lead to acute inflammation, which resolves within days to weeks. However, if it does not resolve, it may develop into chronic inflammation or chronic infection. Whenever you come across the word itis, it means inflammation. Inflammation in the stomach is known as gastritis. In the kidney, it's known as nephritis. In the tissues like muscle tissue, it's known as myositis. In the liver, it's known as hepatitis. So now, if the offending agent is phagocytosed and the dead material removed, is it the end of story? No. Then the adaptive immune system takes over. Innate immunity and adaptive immunity interact, which we'll see in the next video. Thank you for watching.